Well, January has been a very busy month, but before we turn the page to February, we want to take some time to educate women on Cervical Cancer Awareness Month. So Dr. Ijanae Allgood with the brand new Baptist Health Comprehensive Women's Clinic in North Little Rock is joining us now to discuss this very important topic. Thank you so much.
Thank y'all for having me.
Of course. Let's talk a little bit about the new clinic because it's been open for a few months, but you had the ribbon cutting yesterday?
Yes, we did.
How did that go?
It went very well. So it's a women's comprehensive clinic. Basically, we do full spectrum care there. We do from birth to geriatrics, and we take care of women and their children. And we provide acute care, chronic care, anything you can think of.
So let's talk about cervical cancer specifically. When should women start thinking about seeing a physician? How would they know if this is something that they're dealing with?
So any woman they might have cervical cancer. So women should be screened routinely. We normally start screening around age 21. We screen with a pap smear, and most people, that's basically collecting cervical cells to see if there's any abnormalities and do they need further diagnostic testing. And then once they get to age 30, we'll do co-testing with HPV and cervical cytology, and that way, and then we'll do that all the way up to 65. So I say women should always be in the clinic getting their routine screenings.
Is there a specific age of when you would be at risk maybe for cervical cancer?
Well, the older you are higher at risk, but also women who have family history, who've had HPV in the past, women who smoke, women depending on their sexual history. Those are all risk factors that could lead them to have cervical cancer. So we screen everybody.
Walk through that screening process specifically.
So if a woman comes in, they're 21 years old, we do an annual well woman exam. We'll do basically a pelvic exam. We'll do the pap smear. We'll collect the cells. If something comes back abnormal, we call them, we let them know, and then the next step would be what we call a colposcopy, which means basically do we need to just stain and make sure if there is abnormalities, do they actually need a biopsy? And from there, we send them on to the surgeon to see if there's something that needs to be taken care of.
Is there anything that would increase your risk for getting cervical cancer?
Smoking is a big one. If you have your sexual history, depending on your sexual partners, that's a big one as well. And also if you have HPV. So the human papillomavirus is one of the #1 causes of cervical cancer. So that's a huge risk for women. So we screen for that. And there's a vaccine for that, which is Gardasil, and it covers 9 different strains.
Is that the best way to prevent it, or how can we prevent it?
That's the best way to hopefully prevent it, yes. So when we start providing that vaccine at 9, and most women, they don't know, but if you didn't have it in adolescence, you can also get it in your 30s and your 20s as well. So it's a good prevention for cervical cancer.
What would be the best way to make an appointment or just reach out to you for more information?
So you can call the clinic directly, or you can call 188-BAPTIST and you can get in touch with us, and we would love to take care of you. So
anything else that we need to know about Cervical Cancer Awareness Month?
No, I think that's it. I think just the biggest thing is make sure you go to your annual visit. Like, healthy or not, make sure you see your doctor at least once a year.
Perfect. Dr. Allgood, thank you so much for your time.
Thank you.
Really appreciate it.
Thank y'all.